Welcome back, my friends. Welcome to the Patient First Podcast. I'm your host, Dr. Bryan Laskin, and today I'm really excited to be talking about connected dentistry. What does that mean? We'll get into it. But first, today's episode is brought to you by Tooth Apps Connect, the dental health information exchange, which we will describe what that's all about in today's episode. So it's a new concept, I think, for a lot of people in dentistry, patients, dentists, software vendors, distributors, everybody is going to be talking about this soon. So I wanted to get into it, and we're going to be focusing on this key issue because I believe it is the biggest problem in dentistry that I personally am looking to solve right now through multiple venues. And we've talked about it before: innovation, education, standardization. But first, we have to align on what this term connected dentistry means. And we've coined the term, but I think it's because, it's important. It's important to define exactly what we're doing at Tooth Apps and with our standards that we're doing both at the American Dental Association and Dental Standards Institute, and all the great work that a lot of companies are getting behind this movement of connected dentistry that put patients first. And so, I think it's key for us to be clear about what that is. And so I'm going to be talking about it from different angles, but today I'm going to define what connected dentistry is. Ultimately, it's the dental health information exchange. Well, what does that mean? Let me read a definition of a health information exchange. A health information exchange is the mobilization of healthcare information, including dental, electronically across organizations within a region, community, or system. So it's about electronic information and having accessibility to everybody who needs access to take care of a patient, basically. In medicine, there's been health information exchanges, commonly known as HIEs, for over a decade. One issue that they have in medicine is there's multiple HIEs. So then not only do you have to worry about getting the information securely and having accessibility within the health information exchange, but connecting other health information exchanges together. In dentistry, until Tooth Apps and Connected Dentistry, there has not been a dental health information exchange. And that's what the standards that we've been working on at the ADA, ODIN, 1084, and Dental Standards Institute, we've all been working on creating the sort of rules by which the guidelines to develop the first dental health information exchange, such that we can create mobility of information, meaning it can be passed around for everybody. So if a patient moves from your practice to a practice across the country, let alone across the hall, you'll be able to take that entire record, the entire dental record, and send it with the patient, ultimately having the patient be able to do the permissioning themselves. So if they come to your practice as a new patient to town, they were just at the physician's office and they were just at the dental practice, you'll have all that information as a new patient in your practice. Ultimately, what we're doing is putting patients first by putting them in the middle of an exchange. Now, this is a Google image of a health information exchange. So it has hospital, right? But you could replace hospital with dental practice or DSO, right? And in the middle is who? The patient. Why? Because this is the patient's information. All of these records, pharmaceutical information, prescriptions, laboratory information, dental information, hospital information, specialty information, recall information, all of the information is associated with one person that's owned by one person, and that is the patient. So we put the patient in the middle of this hub, and then we connect everybody through the dental health information exchange. That is what connected dentistry is. And what problem does it solve? A lot, right? If you have a practice management software, or which is incorrectly synonymous today with an EDR or an electronic dental record, practice management system oftentimes doesn't have the information of an electronic dental record. Things like radiographs, including CT scans, but even bite wings oftentimes are in a separate software from the practice management vendor, right? Think about other things like paperless forms or recall messages or text messages or secure messages that secure emails that are part of the electronic dental record that sit outside of your practice management software, right? In systems that require each one having their own login, which is, let's face it, a pain in the ass. You have limited access as a dentist to actually any of this information. So even if you wanted to get, like, say, okay, here, use this application to download your information, patient, doesn't exist today except for through Connected Dentistry. And most software vendors aren't compliant with HIPAA and the Cures Act. The Cures Act obviously is relatively new to the dental industry. It's been around since 2016, but doing my best to communicate and educate the industry about the Cures Act, because it's as important as HIPAA. Frankly, HIPAA is about privacy and security, makes things more difficult. The Cures Act is about accessibility, makes everything easier, makes your workflow easier, makes you have more information so you can provide better care. As a patient, you have the information, so you're empowered to make decisions for yourself and be more informed. No longer is your record locked in a prison that even the caregiver doesn't have access to. That's the problem. So that's a huge problem. And then, of course, there's what we call the Dentrax, which is the dent tax. The dent tax. The dent tax is the tax that dentists pay on software, which a lot of people don't realize it's in the back end through high integration costs. So what does Connected Dentistry do? It replaces all of these things. One login for all of your information. As a dental practice, you have one login to every single one of your softwares, and they work seamlessly together through this exchange of data, the dental health information exchange, Connected Dentistry, right? Compliance with HIPAA, because if you're not in the line of care, you shouldn't see a patient's information. Connected Dentistry allows that to happen for the first time in dentistry. And compliance with the Cures Act. If a patient wants access to their data, they can get it. If a dental practice needs information for a patient, they can get it. That's what Connected Dentistry is. And ultimately, it reduced costs for everybody, patients, software vendors, practices, obviously, the seamless workflow, because when we have accessibility to data for less cost, and we don't have to pay the dent tax that's typically going on in dentistry today, it makes everything flow smoother. So all you have to do is get involved. Join the Connected Dentistry movement at toothapps.com. If you have questions, obviously, I love people's comments on the Patient First podcast. This is new to dentistry. This is new, and some things that are new are scary. This actually makes everything you're doing now easier, cost less, and frankly reduces a lot of headaches, like having multiple logins. So, and more secure, frankly. There's so many benefits to this. We're going to be talking about it. It's basically big picture. My next book describes a lot of things associated with this. So it's going to be a topic that we're going to speak about quite a bit on this podcast for a while. The topics of patients having access to their data, dentists having access to the data, all the positive opportunities that unlocks. Because I firmly believe that this is the biggest unlock to elevating patient care and to increasing innovation in dentistry and broadly healthcare in general. So it might be a bigger topic than other topics we've talked about on this podcast. Obviously, I'll talk about timely things and bring in other topics, but this is such an important topic that is so under communicated within dentistry that I'm doing my part. So stay tuned for more about Connected Dentistry, about all the improvements that are happening, all the innovation that's happening in this space, and I look forward to seeing you to that end right here next week on the Patient First podcast. Thank you very much.